Hi everyone. So today I've come up with this video wherein I'll be discussing about removable or fixed orthodontic treatment. That means it's going to help you in deciding and also understanding that when and why a removable or a fixed orthodontic treatment is required, and this will help you in making a decision when your child requires one of them. Now, now, when I say removable orthodontic appliance, that means those kind of appliances that can be removed by the patient on his or her own when taught by the doctor. So the appliance may seem something different than what is shown on the screen, but if the patient is able to take it out on his or her own, that means it's a removable appliance. And by fixed orthodontic appliance or by fixed orthodontic treatment, I mean when you see these kinds of braces that have been adhered onto the tooth surface, it cannot be taken out by the patient willingly. It can only be taken out by the doctor. Obviously, there are cases when these braces, when these brackets come out, they break. So that is a completely different scenario. But otherwise, they cannot be taken out by the patient. Now, what decides that what kind of treatment should be done or should be undertaken? Why this is important is because, see, most of the times it's really sad to see, and it's really sad to say also, patients are being fooled, wherein in cases of removable, that means those malocclusions or those kind of irregular teeth which can be treated just by a simple removable appliance, is being treated by fixed orthodontic treatment just for the sake of making money. So to save patients from this kind of quackery, it's important for the patients to understand that what are the factors that decide between what kind of treatment should be undertaken. Now, the first factor which decides is the age of the patient. See, fixed orthodontic treatment is usually done after the permanent canines have erupted, because these are usually the last to erupt of the permanent dentition. After the permanent canines have erupted, usually, I'm saying, obviously exceptions are always there, usually fixed orthodontic treatment is undertaken. Before that, the simpler kinds of irregular or disarrangement in teeth can usually be undertaken by removable orthodontic appliances. Yes, there is something called as intermittent fixed orthodontic treatment, which involves putting brackets into some teeth, let's say 4, 5, 6, 8 number of teeth, and not on all the teeth. That is a different thing. If you want to know about intermittent fixed orthodontic treatment or intermediate fixed orthodontic treatment, I can put a different video on that. You can let me know in the comment section also. But otherwise, after the permanent canines have erupted, we usually opt for fixed orthodontic treatment. And before that, like some rotation is there, or there is some contraction in the jaw, or there are some spaces, or there are some bad lip habits, or there are certain kinds of cross bites. All of these can be corrected by removable appliances. Okay, then we also take into consideration the cooperation that is anticipated to come from the patient. If the child is very small, let's say a child of 4 years of age or 5 years of age, and in that case the child is, it's not possible for the child to cooperate for him or her to have fixed orthodontic treatment on him or her to be done. So in that case, patient's parents have to cooperate, have to take responsibility, and in that case, removable orthodontic treatment will be undertaken. In a child who is again, let's say, old enough but is still not capable to understand, or let's say is emotionally or mentally challenged, then in that case, uh, again, a fixed orthodontic treatment will be very difficult to uh, get about, because in those cases you have very small brackets that have been adhered onto the tooth surface, and if it breaks, the child is not competent enough to tackle up all those hurdles. So in that case also, a removable will be preferred. So basically, depends upon the cooperation that the child will be providing you. Then we also take into consideration the status or the condition of malocclusion. That means you have to see what is the uh, status of the teeth. If the teeth are highly crooked, there is very less space, and it's absolutely just not possible to move the tooth bodily from one space to another, because removable orthodontic appliances do not bring about bodily movement. They can only provide some tipping. Like, if the tooth is tilted in one direction, they can just tilt it back to the normal position. It cannot move the tooth entirely from one place to another. So all those kind of complex and detailed and bodily movement can only be attained by a fixed orthodontic appliance or a fixed orthodontic treatment. So in that case, a fixed will only do the job. A removable orthodontic appliance will not do the job. So see, it's a very complex topic which I tried to break into simpler terms, because my intention is to educate layman, educate the parents, to not to be fooled by the practitioners. I'm not saying all of them are doing this, but there are some who are doing this, and I want the patients to be educated enough to understand what is being told to them and then make a decision rationally on the basis of their knowledge, uh, to end up in something that is absolutely right for your child. That's it. Um with regards to certain topics which I mentioned, that is those removable orthodontic appliance, I have a different, altogether different video. I will put the link in the description box. You can check that out. With regards to crossbite situation also, I have an entire series. I'll put that too in the description. You can check that out. This will help in understanding the video of today properly. If there is anything else I can help you with, you can let me know in the comment section. Till then, take care. Bye. Thank you.